digital event, Scaling Smart, how providers are leveraging new technologies for better diagnostic delivery. I'm Chris O'Donnell. I'm the Editor-in-Chief and Head of Content here at Healthcare Business International, and I'm delighted to be able to introduce to you today Dr. Gaspard, who is the co-founder and Chief Medical Officer of Incepto Medical. Holding both an MD and a PhD, Gaspard's profound interest in medicine has led him to a dual career as a practitioner in interventional radiology and as a medical researcher. His work primarily revolves around interventional radiology, oncology, and the innovative integration of AI into radiology to enhance diagnostic, quantitative, and image reconstruction capacities. His combinational experience makes him a particularly compelling person to speak to on the matter of leveraging technologies in the field of diagnostics. His experience at the sharp end of radiology within service providers and his understanding of both radiology tools and emerging technology, with his understanding of the opportunities and pitfalls presented in its application, grants him a really valuable perspective. Incepto Medical, meanwhile, is a Paris-based company specialized in leveraging artificial intelligence for medical imaging applications. They curate a portfolio of AI solutions within a unified, secure, and interoperable platform. Their scientific and medical teams develop artificial intelligence solutions or clinical verticals that are not currently addressed by their partners. And they work closely with reference centers to offer solutions that meet the most demanding clinical validation standards. So, on to the question of why are we hosting this digital event today and why are we addressing this topic? Well, we all know that European imaging providers face unprecedented pressure to scale delivery while maintaining quality. Two different demographic crises are converging in the sector, which make digital transformation more than an emerging opportunity, but actually essential in addressing the needs of the general population. The reaching retirement cliff for many groups practicing radiologists. Between 2030 and 2040, almost half of Germany's practicing radiographers expect to retire. This trend extends all the way across Europe, with imaging specialists retiring at a faster rate than they can be trained. Equally, we also have that well-understood megatrend. Europeans are getting older, they are getting sicker. Pathways of care are becoming more complicated, and are becoming more and more complex. The challenge is pretty simple, therefore, to define. We will have fewer specialist hours to apply to a larger and more mutant population. And this takes place against other challenges too. So, for example, the question of who pays. Payer models are in flux. Governments, meanwhile, are finding it difficult or having to make difficult decisions, as indeed are some private sector providers. Money has to go further, despite us facing these challenges. So, imaging providers everywhere are exploring ways that they can address throughput while maintaining or even increasing service quality. And of course, there are a number of tools being utilized by providers so that they can achieve this end. These include AI applications, and we're discussing that further with Gaspard today. These include things like, prioritization algorithms, aided detection for nodules, fractures, and cancers, quality assurance and error detection, and report automation and structured reporting. And of course, there are other solutions too, not really within the world of AI. For example, these solutions provided by teleradiology. And this includes, of course, remote access to the machine, so that a practitioner anywhere in the world and across time zones can deliver their analyses. And that, through cross-border reporting networks, is allowing for innovative models, such as the Follow the Sun approach, which has been employed and pioneered by companies such as teleradiology solutions. It's helping hospitals and other providers to accelerate throughput across Europe and North America. AI and digital tools are also helping to accelerate documentation, improve note-taking, and patient scheduling, and even help companies better plan where their machines will be located. Meanwhile, portable machines and technology are bringing diagnostics to more underserved communities. Which brings me to Gaspard. Incepto Medical and other leading AI companies within the imaging sector are achieving real impact with their sector providers in leveraging these technologies and addressing the question of scalability and throughput. Gaspard, thank you so much for joining us. I know our audience today would love to hear more about the opportunities presented by these new technologies and also the benefits and challenges they can expect through that implementation process. So Gaspard, I will hand over to you.
Thank you, Chris. Thank you very much. So hello, everybody. Thank you for having me today talking about this This great topic, which take me a lot of time and joy and passion. This is so the question you asked to me to address today, and it's a question we were working on for the last years, and I think it's very, very important in all this landscape on AI in medical imaging. And the question will be, what are the clinical evidence, and what are those clinical evidence on AI impact in clinical ways for patients, and on radiology productivity, and what can we see from the publication around the world, and what we are going to see more and more, because we are just a few days before RSNA in Chicago. So that's the question asked, and we are going through some consideration in the next 10 minutes on that. So as you said, my name is Gaspard. I'm a radiologist and co-founder of Incepto Medical. And so the first question, I'm sure most of you are familiar with the problem. It's always good to maybe to reformulate why AI and medical imaging are so compelling weddings, why there is so this trend, which was maybe a hype 7 years ago, but now it's deep wave who take us in a new world of radiology, and especially for us. Why? Because for many reasons, but maybe I would just take 3 of them. We experience, and I experience as a 47-year-old radiologist, strong image production speed up in the last for the last 15 to 20 years. So an avalanche of data coming in front of my brain and my eyes every day. Meanwhile, we all know that there is in Europe and in US a shortage of professionals of radiology, of radiologists with strong pressure on remaining radiologists. And meanwhile, we have we experience in radiology what the other part of the medicine experienced sometimes recently and partially, which is dematerialization. So medical imaging have been dematerialized between 15 and 10 years ago. It's fully dematerialized. So new tools, and especially new AI tools, can be applied on those images, and can try to solve those problems of data, of amount of data, and shortage of people in front of that. So the market size of AI in medical imaging is estimated around 2 billion now, and will increase in the next year. So depending what agency you follow, but it will increase maybe up to 7 billion in the next 5 to 10 years. And in the meantime, AI are increasing very fast, and you know that there is a raising of not only medical imaging AI or text AI now, but multimodal AI solutions are coming fast. So looking at all this together, we see that medical imaging and AI is a very active domain, also in venture capital world, and in the real world in medicine every day. You will have a lot of interesting things, maybe in dermatology, but or in pathology, but yet dematerialization is not completely finalized in those domains, and so we are at the forefront of this technology shift. So from where I talk to you, from my perspective is developing Incepto with my partners and co-founders during the last 7 years now. We founded the company in 2018. We are now 80 people across Europe. And so we developed a platform to bring AI solutions in medical imaging in real life in the hands of radiologists, private, public, large, small groups. So we actually have 350 sites who are currently using all the 30 applications of our portfolio. And we are running those studies on 350,000 exams per month. So we have now this experience, and we took the lead of the platform game, we can say, in France and now in Europe. So we are a European company based in Paris, and now we begin to have more and more activities across the ocean in the US. So the idea from the beginning of this company was to do both things, to be able to distribute all the very good AI solutions that you can find in many startups and companies, and also to be able to create our own solutions when there is a lack or there is an opportunity somewhere. Building so this portfolio, and also building one single entry point to make it for real in the hospital, because there is a lot of interoperabilities problems and challenges, and so we needed here to be a very good plumber and to bring those solutions in real life and not in paper, something that could maybe rely on the shelf but not be used in real life. Because as a radiologist, we know that if your tools is not completely fully integrated in your workflow, there is a big risk that you will not use it, you will never use it. And there still is a challenge in terms of usability and acceptance here. And so we drive adoptions by building clinical and business cases with our partners, and that's how we managed to reach this position and interesting positions to look at this space now. So just for those who are not familiar with those type of algorithm, I just show you three type of algorithm. One is very classical. It's automatic detection of bone fracture, for example, here, and you will have just a box around here a clavicular bone fracture. You will have automatic detection of breast cancer, another type of solutions. So you will have automatically determine the type of risk of breast cancer you can have. And for example, it can be very powerful here, because you see, if I took a patient, a female over 50 years old for screening, and I don't have these AI tools, the risk that I found a cancer within these patients will be 1 on 6,000. And if I have a high level of suspicions with those tools, now the risk will be 1 out of 10, or maybe 1 out of 5. So you can see the ability for triage and to increase the performance of detection is now very high for a disease with a very low prevalence, which is very important. And now we are more and more in much more complex, also tools in more complex 3D images, especially in CT and in MRI. This is an internally developed tools within Incepto Lab, who automatically detect and segment prostate cancer in MRI. There is a lot of demand in those domains. So just 3 examples, but to show you the type of algorithm that we are now able to bring to clinicians, to radiologists in their daily workflow routine. So saying that, what are we talking about when we are talking about clinical impact on AI? I think there is 2 major subjects here. One is about quality of care. So are we able to bring more accuracy, and also coordination of care, because you can have impact on the patients by adding AI plus a way to reorganize your unity, especially true in the emergency room. It can be true also in the journey for early detection of cancer. And so quality of care is typically a strong domain where there is more and more of evidence. And the other part is productivity. And productivity is also a domain when you will see more and more publications, and productivity is a word per se, because you have a lot of things to monitor and to be sure that you are talking about productivity in real life. And is it about AI in image, AI in text, or integration of all of this? Those are the questions we can ask ourselves with the productivity domain. let's take a look in quality of care. Quality of care, what we saw here, and I think from a radiological perspective, it's very interesting. So can we improve human performance with new radiological tools? We all know new CT scan, new MRI, and they are doing incredible images, but it was sometimes difficult to maybe break this glass ceiling of improving our performances in terms of diagnosis, of sensitivity, specificity. Even if you are maybe a Siemens, a General Electric, a Philips, a Canon, a huge company, and you invest 10 or 100 millions of dollars, and they are doing that, and they are right to do that in new hardware. It's difficult to improve dramatically the human performance in terms of diagnosis because we already have very, very good hardware and those type of tools. But what happens here is the software and this AI software appear to break, to be able to break this glass ceiling in terms of performances on detection. And how do you say that? Or how do you see that? You see that because it's true in all type of domains, so emergency, musculoskeletal, cardiovascular, oncology, neurology, in all modality. If you look at the paper in the literature, at the beginning of the AI, you had human versus AI publication, more and more. And when you see here is more and more what we call reader study, which is human plus AI versus human. And we see that it's increased the sensitivity, the specificity, and it is not increasing this by maybe 0.5 or 1%, but by major numbers, such as 5 or 10%. And so that's what we see. And if we look at examples, we are not going through all the publications on AI imaging. You can imagine that this is a bit too much, but just take a look of a very important field, which is oncology. And within this field, you have 3 major subjects because those subjects are addressed by radiologists in the early detection phase, which are breast, lung, and prostate. If I just take a look into breast, do we have a high level of proof of impact of AI in this domain? And the response is clearly yes. And something happened which is very rare in radiology. It was, I think, the first time, is in 2023, we've seen 3 prospective studies on very large populations. This type of study, we never see that in radiology. We see that in cardiology, in oncology, but not in radiology. So the first one was about 58,000 patients. It was a skin trust study, one company named Lunit. All the time there is a company behind it. The second one was 16,000 patients, but 4 centers in nature medicine, Chiron, third company. And I think the most important one was this Massai study, ScreenPoint Transpara, with 80,000 patients. And if you look carefully, this is the highest level of proof that we can bring and we can build, which is prospective randomized controlled trial. So this is very special because now we have the type of evidence that you was able to see in pharma, in drugs, as I said, in cardiology, oncology, rheumatology. But now you have this type of proof at very high level. And what does that say? If I just dig a little bit into this Massai study, it tells you that if you take, so this is a very good example for sure, because with the breast screening, you have the double reading. So double readings give you the opportunity to do an interesting experience by replacing the second reading, the human second reading, by the AI. You can do that when you have only a single reading, obviously. And so by doing that, you see that if you bring a protocol and you replace part of the second reading by the AI, you are able to cut 44% of the workload with a similar to a better cancer detection rate. So when you do that in a prospective randomized mode with 80,000 patients, you see that you will have the attention of everybody, all the providers, the public health system, because the consequence is everybody now is thinking about replacing second lecture by AI across Europe regarding this level of proof. So is it only for breast? Not for sure. Can we improve, for example, lung nodule detections? So we have more and more proof on that. Example, this paper on Vilung, which is a Vilung nodule, which is now a deep health company, that you can improve 10% sensitivity in terms of detection of lung nodules, and some of those nodules are lung cancer. So this is important. And what is the impact, for example, in Europe here? But lung cancer screening is a major topic now since the NLST, which is the US screening program, and then the Nelson study, which is a European study program for lung screening in 2020. There is an acceleration of work on screening in many countries, France, Croatia, UK. So we are conducting, for example, in France, the study focus on the prediction of impact on lung screening. And you will have the SOLA study, which is a European initiative, which is going to be launched on 10,000 patients in few months. And what is the position of AI in this subject of lung cancer screening? Is it peripheral? Is it central? It's completely central. Why? It is going to play a major role? Because, as I told you, and I show it to you, it increased sensitivity, but also because it increased specificity with the calculation of the volume and the volume doubling times. And you can't do that by yourself. No radiologists are going to calculate this biomarker, which is volume doubling times. So you have no choice. You need an AI solutions to do the lung screening program in Europe. So you can see the place that those type of tools are going to take in the future. Is it only oncology? For sure not. You see a more and more proof of impact. For example, in bone fracture, you have plus 10% sensitivity in a radiology paper. This is the Glimmer works, also Paris-based, very good company. In MRI, we published increased sensitivity and specificity in major lesions. This is an Incepto tools, automatic knee MRI detection, so increasing 7% sensitivity in cruciate anterior ligaments. So a lot of clinical impacts behind that, because if you missed a cruciate anterior ligament lesion in young patients, it can lead quite quickly to osteoarthritis, so major disabilities. And you have those type of proofs coming more and more, and I won't give you let's stop that because it's going to be too much, but you see the trend and look at this trend because it's an important one. This is one trend, so high impact on accuracy, and so high that it's becoming now a standard of care in oncology, in breast especially. But what about gain time? But gain time also, because when you say that, it's great, but you are not sure to earn much money with it if you don't have reimbursement. So what is the trade-off here? You have the impact on the clinical impact, but also you have the productivity gain. And here also we have a lot of paper. This is a quick overview of all papers on the type of tools that we are distributing or not, that we saw in the literature. You saw here, and responding to various type of tasks: the detection, segmentation, reporting, triage. So, and what is the impact regarding those type of tasks, the subjects, the application in front of that, and the amount of productivity. You can see that, for example, for lung segmentation, you have a gain of 70% in terms of time. In terms of neurology, MRI, multiple sclerosis diagnosis, 40% reduction in time. So big numbers here. we conducted an internal study on that, interestingly, in our 3 CE-mark product to see what type of time reduction was here. So we have aortic measurement in CT scan, knee lesion detection in MRI, and prostate cancer reporting. And so we see more and more, once again, from 30 to 77% time reduction here. And what you see also in this curve, which is interesting, so the blue curve is without AI and the orange one is with AI, and you see that the peak is shorter, but also that there is a narrower peak. What does it mean? It means that you have a better assignment of median reporting time within radiologists. So you will have to organize yourself better, because the time you spend to analyze one case, it's much less variable when you use those AI tools. So that's nice, but that needs to be also monitored and proved in real life, but because many of those studies are a bit in silico. And to do that, you need to have tools to bring those AI and those productivity in your workflow, in your report. That's exactly what we have done, for example, with Trier Group in Switzerland. So we showed that we were able to save 40% time in knee MRI reporting in real life, so from discovering the image to the click of validation of the report. And we will have more and more impact on that, for sure, regarding what will be the great topic of RSNA this year and of all our development, I think, in the next months and years, which is a report generation platform, generative AI, and this is what we are going to show for Incepto at RSNA here, with automatically integration of additional information. So you pre-fill your report with AI. If you want to add information, you will have just the image under the eye and pre-fill automatically all this information. This will bring up to 7 to 80% productivity, and it will be a major shift in this domain. So maybe I went a bit longer than, but let's take the question. Sorry for that. So I'm so much passionate about the domain. My 2 takeaway message: clinical and economical impact are gaining ever higher level of evidence. I hope I bring you some good information on that, and I was able to convince part of you. And the challenge, I think, remains to implement these solutions in real life and monitor the impact. There is a lot of things to say about that. And with that, I thank you very much for your attention.
Well, thank you so much, Gaspard. That was, really interesting in terms of, again, yes, that clinical impact, but also the productivity, and obviously how that will affect the business case as well for implementing these tools. Certainly very interesting, very striking as well. And thinking about that second question that you sort of raised at the end there, that implementation period. Obviously, that's sort of one of the key challenges, isn't it, for companies, for organizations, where we can talk about the utility, we can talk about the benefits, but actually bringing those into people's clinical practice, into business practice, introducing patients as well to these new workflows and tools is really, really important. So thinking about that question, and based on your experience, both as a practitioner, but also your experience within Incepto, what have you found to be the most effective strategies in terms of, because we have a number of stakeholders here, one of them, of course, being radiologists. And one of the reasons as well why there's such a need for these tools is because there's a very large older cohort within the professional population of radiologists. So how do you find during the transition period, what sort of strategies are perhaps most effective to turn these stakeholders into engaged stakeholders and to help them as well to implement these tools?
Yes, Chris, thank you. This is really a key question, I think. And I think when you do this type of company, there are things you manage to do, and you have some success, you have some failure, for sure. And I think once there is something we succeed to go over is how do you make it for real, and how do you make it happen, and you conduct a change within the organization when you are implementing that. So the idea from the beginning, I think, is first is not to do just a pure marketplace where you bunch everything you can find and you say to the radiologist, okay, choose what you want, you just have to click here and you will find yourself the way to use these tools, the good way to use these tools. This is not the way it works, and I don't say this is the way it works, and I think this is also why our partner, all those who are distributing, are quite happy with us, because we are bringing business, and there are not so many platforms who are bringing business on that. And why? Because we curate, and so we spend a lot of time to curate, and to not to bring a pure marketplace, but a curated portfolio, because we know very well the partners, the type of solutions they have, the type of proof and implementation, and we spend. So we are a service. We are also a service company, so we spend a lot of time at the beginning, and we have all the process of onboarding the radiologist, the IT chief, the general manager, and to bring information at the different level and different time frame of the process of implementation. So we could dig into that, but this is very important. For example, we have clinical specialists within Incepto. The work is to know very well the solutions. Sometimes you do the link between the developers, the startup we are providing, and the clinicians, especially if you want to do study, if you have academics, but also in private practice. But we are very concrete on that. And one important thing is to set KPI from the beginning. So we are around the table with the radiologist, and we say, okay, what do we want to achieve? What will be the KPI? Let's try to make a photography at the beginning, and come back at 1 month, 6 months, 1 year, and to look at the impact, and that works quite well.
Well, thank you very much. And that sort of leads me to another question too, then, around implementation and around providers actually being able to utilize these tools, which is thinking about it from, again, that implementation perspective and strategy. What approach are you finding tends to be working better for providers in the market? So is it buy, is it build, or is there a hybrid approach that you find perhaps is best for gaining traction?
So that's also an interesting one, and I think that there is not one answer to that. What we've seen here is there is more and more large groups, private and public, who want to build, also who have a lot of data, a lot of knowledge. And so, but they need to partner. They need to partner with company like us. There's a lot of wonderful company with wonderful data scientists and wonderful data science and development capabilities, and also in terms of quality management. A lot of things that you can't completely handle when your work is to be a large private radiological group, for example, but you have the knowledge, the data, the real life implementing place, and so you will see strong partnership, I think, between those type of actors. After you will so exactly you have for example RadNet and DeepHealth, which are this is a synergistic things. From the beginning, a lot of large public hospitals were thinking that they are going to do their solution by their own. I think this is really a specific job to do the solutions, to build them, and also another very specific work to bring it into real life in the radiological workflow and to bring the impact. So it's always around collaboration and doing a synergistic strategy. I think I would be very happy to maybe to do roundtable one time about that, because I know everybody has not the same strategy. Within Incepto, we are a lot about, we believe strongly on partnership. From the beginning, we always said we are not going to do everything by our own. And that's why we wanted to be a platform and to distribute solutions that are crazy, increasing good solutions. Transpara, as I showed you, is a game changer in the world of mammography. Let's bring it into radiological hands and let them do the incredible works to build the solutions.
Well, thank you so much. And I noticed, by the way, we're starting to run out of time. So I wanted to go to at least a couple of our questions that have been put to us from attendees today. Unfortunately, we can't get to all of them because we're a little short on time. But so we did have one question from Erin Niehaus, who's a partner at Digital DX. And they asked well, we're interested in how one quantifies the return on investment and the productivity gains of AI in diagnostics. So I know you touched on that a little bit before, but if you could expand on that a little.
Yes, that's very important. When you looked and we do some deep dive within large private groups where we implement solutions, we see that we can bring more productivity on that. To monitor that, we need to do photography at the beginning, and as I told you, and to monitor the time they gain in terms of report production. Also, we have some tools of pure productivity. I didn't mention that, but when you distribute solutions at Subtle or Swift, those tools are increasing the number of exams that you're able to make. So this is a quite simple equations. In terms of radiological productivity, it's a bit more tricky. So but you, as I showed you, let's take the evidence in the literature. This is one thing. Let's take the evidence in real life. And so what we do have, because we have the orchestrators and we are able to integrate in all radiology information system and PACS. And so what we are doing is conducting studies, internal studies within the company to say, okay, this is the time it took us to do the report and this is the quality we want to achieve. This is day one. We implement the solutions. We monitor, and at day 30 or day 60, we'll show you that we bring and we shorten the time, and we are able to monitor that because we have a cockpit and we have a process to do that. For example, in large group in Switzerland, we saw that we were able to have impact on 5 to 7% on EBITDA with this productivity. At the end, there is a special question here: is what do you do with this money? This is the time. So this is money that you saved. Do you do more exam, or do you share this money with your radiologist? So what is the governance of those of this productivity? But the productivity is here, and we have those process to monitor it.
Well, thank you very much. Thank you. And of course, yes, we touched on, or rather you touched on some of these KPIs too earlier in the presentation. We only have time, I'm afraid, for one more question. So we'll take one from Francois Clarin from GE Healthcare. So at what step in the imaging workflow will AI orchestration take place?
Yes, I see this is a very good question, and I know G have a lot of things to say about that and a lot of ideas, and mainly I'm sure good ideas. My perspective on that is you want to be neutral in terms of platform. So when you're very good, you're very neutral. You can talk with all type of system, and so that's where the platform is between the image, acquired image, and the final structured report given by the radiologist to the others, to the EHR meantime. So you have to be between the image and the final information, and you have to be able to talk to the PACS if you want to talk to the PACS, talk to the OEM if you want to talk directly to the OEM, and you want to talk HL7 also to be able to talk to the RIS and to the electronic health record, and you need to bring this agility and this a bit plumber thing in the system, a bit seamless, to be able to bring the productivity. And I think this is the key. So it's a lot about also interoperability and knowing well the way radiology are working, because you want to smooth all the process and not to add some noise and some complexity, which is not so easy to do.
Well, thank you so much. Thank you, Gaspard. And I'm afraid that I'm going to have to cut it there because we're right up against time. But thank you so much for your time today, and both for presenting some of the insights. There are many, many more that we could tap into in terms of both the implementation journey and the opportunity that's there, most particularly with AI within diagnostic imaging. There's a lot more as well for us to explore. So this is the first of a number of HBI webinars, which will also cover sectors from dentistry to ophthalmology. I'd also like to quickly, before signing off as well, just direct everybody to, well, attendees, I think you should be able to access already the report that came out of the ACES 24 conference. So that conference was where I had the pleasure of first meeting Gaspard, and that was hosted by Incepto in Paris, and discussed again a lot of the opportunities, particularly around AI and technology in imaging as well. So I would recommend that's accessible to anybody, be they a subscriber or not a subscriber, on the HBI website. But do as well feel free to reach out to your account manager if you're not able to access it and find it. So once again, Gaspard, thank you so much for your time today. And thank you everybody too for joining our webinar. And I hope to see you all at our next one. Thank you very much.
Thank you, Chris. Thank you, everybody. See you at RSNA.